Thank you, Mr. President. My instructions from the President were very clear. I was to do everything imaginable as aggressively as possible to protect the 9.5 million veterans who are part of the Department of Veterans Affairs. Last month, we established 19 emergency operations centers across the country. We began to limit the number of visitors who entered our facilities. We began, I think, we were the first system to begin triaging across the country in our 170 hospitals the entrance of anyone into our facility without being questioned or tested. We expanded those restrictions to those in our 135 community living centers, which have about 7,800 veterans who are in acute conditions, to make sure that they were protected. We also took the next step and made sure that we limited the dental surgeries that we were provided. We've cut back by 1/3 the number of routine appointments we have had, and we have canceled elective surgeries. These were all part of the President's directive to be as aggressive in a public health sense as we could be. And I think we have set the pace for the entire country. I will say, we've often said that we work the most noble mission in the federal government. Our veterans have been in the toughest spots in the world. They have been put in conditions that are unimaginable to most Americans, and they have responded. They have responded clearly. They have responded with passion, and also the 400,000 members of our department who are out there on the front lines. The last thing I will say is that you've heard a lot about the fourth mission that VA has. Our first three missions are health care, benefits, and memorial affairs. Our fourth mission is to support the federal government in times of natural disasters and pandemics. We are the buttress force in case that FEMA or HHS calls upon us to deploy medical professionals across the country to meet crises. We plan for that every day. We are gaming out emergency preparedness scenarios, and we stand ready when the President needs us to expand our mission. Thank you.
Thank you very much, Robert. Thank you.
Thank you all.